Welcome to Dr. Balaga's God Knowledge Doc podcast, your quick dive into the latest medical breakthroughs to keep you ahead of the curve. Let's get started. Today is November 23rd, 2025. This video is on a New England Journal of Medicine review article, titled Long QT Syndrome, published online November 19, 2025. What is long QT syndrome? It's a genetic disorder characterized by prolonged ventricular repolarization, increasing the risk of torsades de pointes and sudden death. How common is long QT syndrome? Its documented prevalence is about 1 in 2,000 live births, though the true prevalence is likely higher due to phenotype negative carriers. Which genes cause long QT syndrome? KCNQ1, KCNH2, and SCN5A account for 90% of cases and encode key ion channels affecting cardiac repolarization. What symptoms suggest long QT syndrome? Syncope, palpitations, seizures, or cardiac arrest, often triggered by stress, loud noises, or sleep depending on genotype. What ECG findings are typical? Prolonged corrected QT, notched or biphasic T waves, and T wave alternans are classic abnormalities. Why is QT corrected greater than 500 milliseconds concerning? Corrected QT above 500 milliseconds strongly correlates with increased arrhythmic risk. How is long QT syndrome diagnosed? Diagnosis relies on ECG patterns, corrected QT measurement, exercise testing, Holter monitoring, and genetic testing. What triggers arrhythmias in long QT1? Physical exertion, emotional stress, and especially swimming. What triggers arrhythmias in long QT2? Sudden noises, awakening from sleep, postpartum sleep disruption, and low potassium. What triggers arrhythmias in long QT3? Events often occur during rest or sleep due to sodium channel dysfunction. What is the first-line therapy? Beta blockers, propranolol or nadolol, substantially reduce arrhythmic risk. Why is metoprolol avoided? It's less effective and associated with higher recurrence of events. When is left cardiac sympathetic denervation used? When syncope recurs despite optimal beta blocker therapy or during electrical storms. What is mexiletine used for? To shorten QTC in long QT3 and some long QT2 variants, improving repolarization. When should ICD be implanted? After cardiac arrest or when triple therapy fails and the risk remains high. Can lifestyle modifications help? Avoiding QT prolonging drugs and maintaining potassium levels lowers risk. How often should patients be reassessed? At least annually, because arrhythmic risk changes over time. Does intense athletic training affect QT? Yes. Training-induced QT prolongation can mimic long QT syndrome but reverses with detraining. Is gene therapy available? Experimental approaches exist, but current therapies already provide excellent long-term survival. Can acquired conditions cause QT prolongation? Yes. Hypokalemia, bradycardia, and many IKR blocking medications can induce torsades de pointes. This frame is about eponyms associated with long QT syndrome. Hit pause and read at your leisure. If you enjoyed this episode, share it with your colleagues. When we change how we see disease, we change how we shape lives. Until next time, stay curious, stay compassionate, and keep seeking wisdom. Podcast brought to you by masterful.com. This podcast is for physicians and healthcare providers. If you enjoyed this video, please like, subscribe, and forward to your friends.